In today's video, we will be enhancing this patient's jawline. So starting off, I have the patient always sitting upright so I can go ahead and mark just while we're appreciating gravity and what this treatment is actually going to look like versus when the patient is laying back. So I'm just marking some dots for my insertion and then my distal end of my vector, and then connecting the line so I have a nice guide of where I'm going to be placing my threads. Now I am just placing some lidocaine with epi. I like to use a little bit of epi just because it helps vasoconstrict. I don't have an assistant as I'm treating, so I like to minimize the bleeding as much as possible. She has her headband on. I have a piece of gauze there as well just to make sure I am covering her hair as completely as possible. This is an 18 gauge needle. I'm just making a pilot hole, an entry point for my cannula, and I am using a 75 millimeter cannula. We are going to be using this to create a vector for our thread to create a little opening. And then I have a little bit of lidocaine in my syringe. I don't love to place a ton of lidocaine just because my thread will kind of be floating around if I have too much liquid. So in her case, she has had threads previously. She knows what to expect. She's very comfortable with the treatment. So for her, as long as I'm in that correct plane and I'm gliding along, she is comfortable. At any time, if she were to feel more uncomfortable than other areas, I do have that little bit of lidocaine that I can go ahead and push through my cannula. But as you can see, we're just chatting along as she is getting her treatment. So she is comfortable. So just once I pop through some of those ligaments, I am able to glide relatively easily all the way to the bottom of that vector, and then just giving, like I said, a little splash of lidocaine, but for the most part, she is very comfortable. Now we are going in with a VSoft Lift 18 gauge by 100 millimeter thread, and I am going down to that patient's jowl. It is very important that you are placing your threads either before or after any area of animation to avoid thread breakage and to ensure that we don't have any sort of puckering or excess pulling on that thread. Another very important part is ensuring you are at an appropriate depth. So as you can see, as I'm tenting up, you can't see my cannula, but almost like a white tinge. I have a nice little tent of tissue over top of my cannula. And I want to make sure I am going as far in as I can. I want to leave as much thread as possible. And I'm going all the way down into that jowl. Even if the patient, has heavier tissue and it's completely past the mandible, I am still placing that thread as far in as I can possibly get. Going ahead and removing, just giving a little tug to ensure my thread engaged, and clipping as close as possible to that insertion site so that thread snaps back and I don't have any thread visibility. I like to keep these little band-aids on for the rest of the day just because we're so close to the hairline. I just want to make sure that area stays as clean as possible. And now we're going to be following that exact same process. I'm going in with my 18 gauge needle, making my insertion, and then we'll go ahead and grab our cannula. Now I have my 75 millimeter cannula. Again, just a little bit of lidocaine, a couple hash marks, just in case if the patient were to need it. And I'm following that same pattern. I'm using my right hand. I'm right-handed, so I'm using my dominant hand to hold my syringe and put a little pressure and push. Sometimes I'll use a little bit of a twisting motion as well. And then I'm using my left hand, I call this my smart hand, to palpate and feel where my cannula is, where the end of my cannula is, to ensure I like my depth and I'm never losing sight of where the end of that cannula is. And we are following that same process for both vectors. I'm just gliding a little bit, tenting up, ensuring I like my depth, and just having that same depth across the entire vector. Any dimpling that you see when you're tenting up that cannula, you will be able to see when your thread is placed. So we want it to be as smooth as possible. Again, I am using an 18 gauge thread for this patient. I like to put that 3cc on the end of my cannula. It's a nice little hack to be able to pull back in case you were to need it. This patient has had multiple sculpture treatments, hyperdilute radius, threads. She has great tissue, so sometimes, as you can see as I'm pushing through, it's a little bit difficult to push through. So at some points I did have to back up and adjust a little bit. So putting that 3cc on the end locks in my thread, so I am able to readjust if need be. If you don't have anything holding that thread on the end of the cannula, as soon as you pull back, that thread is going to engage and it is going to stay where you put it. So if you are at all superficial or too deep, that is where it's going to stay. So that 3cc is a nice little hack, especially if you don't have an assistant, you're treating on your own. It's nice to have that available on your tray in case you need it. Following that same process, giving a small tug just in making sure my threads are fully engaged, and cutting as close to that skin as possible so that thread retracts back in so we don't have any thread visibility. And again, just placing a Band-Aid to ensure and prevent infection and just keep that area as clean as possible.